Hello, hi, my name is Muhammad Imran Samudin and we are from TBA1145E going to present about the effect of COVID-19 towards employees' health. Coronavirus is an illness caused by virus spread from person to person. The virus that causes COVID-19 is a new coronavirus that has spread throughout the world. COVID-19 pandemic has impact not only physical but also emotional health and well-being. As human beings, employees also might put their health for the sake of their family. Therefore, the importance of this issue, impact of this issue, and also the solution of the government and our recommendation of solution will be explained in this report. New normal like work from home, vaccination becomes priorities this day, even though the most of the staff agreed to be vaccinated. This data will help the Ministry of Health plan to create herd immunity against COVID-19. Strict SOPs are suitable to prevent any escalate to COVID-19. Stay safe and wash your hands. Thank you and Assalamualaikum. See you next time.
Assalamualaikum. My name is Amin Shafiq from BA1145E and I will talk about the importance of the issue. It is important to know the issue in order to tackle those issues itself, not just for the workers, but even the society knowledge about the COVID-19 pandemic play a major role for solving this issue. The alertness of the society to adopt new behavioral change measures from the health authorities is determined by its knowledge, attitude, practice, or for short KAP, concerning the COVID-19. The KAP studies will give an insight for resolve the solution needed to influence the society perception about the virus. The success of the KAP research on COVID-19 among the society would be very beneficial in providing baseline into the awareness and the development of prevention and health initiatives. During the 2002 until 2004 SARS outbreak, which is similar to the COVID-19 pandemic, one of the studies we have learned is that the knowledge and attitude are linked to the level of panic and emotion, which could make the pandemic situation worsen to control the disease. The studies that were gained from the SARS outbreak gave a general picture of the Malaysian's COVID-19 prevention activity prior to the Movement Control Order or MCO. Such activities can help the government to prepare better for the infection disease that will come in the future. It is also beneficial for informing efforts targeting and increasing the public awareness to be more prepared with the pandemic management measures in the future. In the studies, finding also shows that pandemic had a major impact on job depression and anxiety in the retail industry. The association between COVID-19 salary and unemployment are in a significant amount. This finding gives an insight into the elements impacting human capital management and how retail decision makers, retailers, retail consultants, and workers should create a new strategy to adjust human resource policies in the new normal environment.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Termizi bin Shafaruddin from TBA1145E and I will talk about the effect of COVID-19 towards the employee health. First of all, there's two main health issues that affected employee because of COVID-19. The first one would be mental health and the second one is physical health. From aspect mental health, there is two situations that give impact to employee mental health. First, because of the struggle with the job and living alone. Second, because of they losing the job. From aspect physical health, there's only employee that get affected by the virus and get hospitalized. Now, let's look at the mental health first. The first situation that we will look at was many employees start to struggle with work-life balance, inadequacy of home setup, and severe loneliness. According to a research, humans cannot live in alone or isolated. If such situation happen, an individual mind will get a huge impact. The worst case would be someone would become crazy from the loneliness. That only just from the loneliness only. We still do not count the stress that he or she got from the work that they must settle. This will only make the situation worse. Now, let's move to the second situation. The employee lose their job. Based on our findings, we find out nearly 100,000 people has lost their job. Not only that, over 600,000 middle income household and 40 fallen into B40, that is low income category. Looking at this, what would happen to B40 category? Not only that they struggle to feed their family before the pandemic, but now it became worse for them. With employee lose their job, how they will get to survive with their family. People that go through this will become stressed thinking the solution to survive in this pandemic. As a result, over 85% of calls to hospital involve in mental health issue requiring emotional support and consulting. Now, let's take a look at physical health. The impact would be only employees get affected by the virus, then it will spread among them at the workplace. This is the only impact of COVID-19 to their physical health. The worst case surely death. We know that the virus is deadly, but there are still people that underestimate it until their family members or himself get it. The most case recorded was in manufacturing industry because of the factory that still operate, although the virus still spread like crazy all over the place. There would be only two reasons for all of this. First, the mistake of management, or second, employee itself that do not follow the SOP. That's it from me. Thank you.
Assalamualaikum, my name is Muhammad Hilman bin Hashim from TBA1145E. Today I will discuss about solution by government and organisation to control and prevent COVID-19 which is plaguing nowadays. To begin, the Malaysian government has declared the adoption of the Movement Control Order MCO on March 18, 2020 to break the chain of the COVID-19 virus that is slowly affecting the country. Malaysians are also urged to practice good personal hygiene by wearing a face mask properly, washing their hands, and using hand sanitizer on a regular basis to avoid contracting COVID-19. If you are in a crowded environment, wearing a face mask properly can help protect your health. In addition, former Malaysian Prime Minister Tan Sri Muhyiddin Yassin also mentioned the slogan "Stay at home" after the government has announced the implementation of a Movement Control Order MCO. Malaysia must also prioritise personal safety by looking after themselves to protect the health of others around them. Now we will go on to the next slide. The Ministry of Health MOH is a key player in ensuring optimum preparation to stop the virus from spreading. The MOH enforcement of health screening at all entrants was one of the first step it took to prevent disease spread. To improve the identification of fever among visitors and locals who have returned from a vacation abroad, body temperature detectors have been installed. To prevent the virus from spreading further, the government has mandated the placement of body temperature sensors in every corporate establishment and any place in the public view. The Ministry of Health and the government will take the next critical step in combating COVID-19 by boosting the number of facilities and equipment required to treat COVID-19 disease cases. The Malaysian Health Ministry has ordered private hospital to boost the number of beds in ward and intensive care units ICU to cope with the rising number of COVID-19 patients crowding government hospital. To handle COVID-19 patient, all private hospital now treating them must add extra beds. There will be extra bed in the wards and in the ICU because of this. Next, the organisation and government begin developing personal protective equipment (PPE) for frontline staff such as hoods, face shield, plastic apron, and shoe covers to help alleviate the burden on frontline workers. Various sectors of society also contribute to easing the burden of providing PPE for frontline workers to protect their safety because they must interact with COVID-19 patients face to face, which can affect them. Not only that, but the government has taken proactive measures to combat COVID-19 spread by launching the National COVID-19 Immunization Program. The vaccination rate in Malaysia has been described as smooth and good because it now stands at 77.9% for those who have fully vaccinated and 79.2% for those who have gotten at least one dose of vaccine. Not only that, but Malaysia's teen vaccination rate is one of the highest in the world, demonstrating that the government is concerned about the COVID-19 outbreak that is currently ravaging the world. That's all from me. Thank you.
Assalamualaikum. My name is Amirul Aiman bin Abdul Aziz from BA1145E. Today, I will discuss about our recommendation to the government for how to solve the problem of the effect of COVID-19 on employee health. Today, the impact of COVID-19 not only affect physical health but has indirectly contributed to employee mental health problem. This is because employees have been burdened with financial problem due to loss of source of income due to several factors such as being laid off or given unpaid leave due to problem from the loss of employer as a result of this pandemic. Employee financial problem have resulted in them now facing mental health problem. To overcome this mental problem, the main cause must be addressed by the government, which is the financial problem of employee. Therefore, we will focus on several recommendations to the government in overcoming the financial problem among of employee in the next slide. So, keep watching. Firstly, employees facing loss of source of income are now burdened with the inability to pay bank debt such as home and vehicle debts. Because of that debt burden, employees are at risk for mental health problem. Therefore, the government should extend the duration of a special moratorium program for employees experiencing financial difficulties. With the extension, employees are not burdened with debt and are given space to use their saving towards survival. Next, the EPF need to pay attention to the complaints from contributors by allowing them to withdraw part of their saving from the EPF. Today's difficult situation makes them desperate and there is no other way to get financial resources other than their contributions in the EPF. As for the contributors who are eligible to withdraw their savings, they have not received confirmation from the EPF, where we believe that the EPF or other government agencies have failed to ensure that those who are entitled to receive part of their savings. In consideration of that, we also recommend to the government to ensure that the distribution system is properly scrutinized so that those who really need it get these benefits. Finally, the government needs to take initiative to reduce the cost of living, where the government have to cooperate with electricity companies and water supply companies to delay or reduce the amount of bill payment temporarily so that those affected employees can breathe in this dire situation. From the objective, we also recommend to the government to establish a public market and sell such essential goods at cost or subsidized price. Only those who are eligible or in financial trouble can shop in the market. With this initiative, it can alleviate the burden of those who lost their source of income to spend, thus preventing stress from occurring among employees. If the government can alleviate the economic burden among employees, the mental health problem of employees can be overcome and at the same time can prevent suicide cases among employees from occurring in our country. That's all from me. Thank you.